Welcome back, everyone. It's wild to think we're already at the end of Season 2 of our deep dive into drug discovery. I mean, from picking out those promising targets to digging through like mountains of data to find those awesome leads, it's been a crazy journey, hasn't it? Remember way back when we started, like forever ago, just going over all those potential targets, trying to figure out which ones were, the real deal, the ones that were going to make a difference.
Yeah, target selection, super important first step. It really sets the stage for everything that comes after. And, it's way more complicated than just pointing out a protein and crossing your
Oh,
fingers.
for sure.
We saw how some targets, especially the ones involved in stuff like multi-drug resistance, those are just inherently harder to drug.
Yeah, those tricky ones,
Yeah,
right? Like
exactly.
trying to, I don't know, hit a moving target, but it's also wearing camouflage.
Perfect analogy.
But then on the flip side, we saw how picking a target that's, biologically relevant, one that's addressing a real need that's not being met, that can really pay off big time later on.
Absolutely. And once we had our target locked in, that's when the real fun began, right? The hunt for those hits,
Yeah.
the molecules that could actually bind to our target and maybe even like change how it works. Remember that feeling when we finally found a compound that showed some real promise?
Oh, yeah, that was awesome. It was like a huge victory after weeks of just like going through data, tweaking those molecular structures. But then came the reality check, lead optimization. It wasn't enough just to find something that could hit the target.
Yeah.
It also had to survive that trip through the body, all those crazy metabolic pathways.
Yeah, that's where things got really interesting. Remember when we went deep into ADME?
Absorption, distribution, metabolism, excretion. Yeah,
Exactly. We learned that making a drug candidate super potent is only half the battle, right? Because a potent drug, if it gets destroyed by the liver before it can reach its target, or if it hangs around in the body for too long, causing all sorts of side effects, it's basically useless.
totally. That's when it really hit me, how even tiny little changes to a molecule can make a huge difference in how it behaves in the body.
Mm.
It's crazy how much complexity is packed into something that seems so simple, like a drug molecule just doing its thing in the body.
Yeah, it's a real testament to how amazing and intricate biological systems are.
Mhm.
Speaking of complexity, remember those reactive metabolites? Those were wild.
Oh, yeah.
They really highlighted how important it is to understand not just the drug itself, but also what happens to it once it gets into the body.
That was a real eye-opener for me. It's
Yeah.
like fascinating and kind of scary at the same time to think that even after you've optimized for target binding and stability, a drug could still fail because of what happens after it binds.
Yeah, exactly.
Can you remind us again what makes these reactive metabolites so tricky?
Sure. So most drug metabolites are pretty stable, they get excreted eventually. But some, they can become like pharmacologically active or even toxic. And those are the ones that can cause a whole bunch of problems from, mild side effects to really serious stuff like liver damage.
So it's like you're playing this game of molecular chess, right?
Right.
You got to anticipate how the body might change the drug and then plan for all those potential problems.
Exactly. Take celecoxib, for instance. This popular KEOX2 inhibitor, right?
Yeah.
It initially seemed like a great alternative to the traditional NSAIDs because it had fewer of those nasty GI side effects. But then it turned out that one of its metabolites was reactive, and that could potentially lead to, like, liver toxicity.
Wow.
Yeah.
That silicoxib example, it just goes to show how even what seems like a small change to the structure can really affect how a drug is metabolized and its safety profile. It's a good reminder that drug discovery isn't just about finding the right key for the lock.
Right.
It's about making sure that key doesn't accidentally unlock a bunch of other doors that you don't want open.
That's a great analogy. And this whole thing about reactive metabolites and how they can impact things, it's not just some theoretical thing. It directly affects how we design and choose future drug candidates. It's a key piece of the puzzle when you're trying to make therapies that are not only effective, but also safe for people.
Speaking of safety and effectiveness, maybe it's time to revisit some of the setbacks we had in Season 2. Remember those drug candidates that looked so promising at first, but
Yeah.
then, they kind of stumbled during development?
Yeah, for sure. Those were some tough lessons. But, they were valuable, even though they were disappointing at the time. Each one gave us important insights that are going to help us as we move into this even more complex world of preclinical development.
Absolutely. It's easy to get all excited when you have a good lead, but those setbacks, they remind us that drug development, it's a marathon, it's not a sprint.
Yeah.
And figuring out why things fail, that's just as important as celebrating the wins. You're right. Like they say, you learn more from your mistakes than from your successes. But how do those past failures, how do they actually help us succeed in the future?
Well, think about that candidate that just couldn't stay stable. Remember how we figured out that it was being metabolized super fast by a specific enzyme in the liver?
Yeah, CYP3A4. Like the Pac-Man of enzymes, just chomping away at our poor drug candidate.
Exactly. And that failure, it taught us how important it is to check for those metabolic problems early on. Now we know, right? So we can design future candidates, and we can keep CYP3A4 in mind. Like maybe we tweak the structure to avoid that metabolic pathway, or we find different ways to give the drug that bypass the liver altogether.
So it's like, scoping out the enemy's moves and then adjusting our game plan. But those early failures, they also showed us how hard it is to predict how a drug's going to behave in people. Remember all those discussions about PKPD modeling?
Oh yeah, definitely. PKPD modeling, trying to figure out what a drug's going to do in the human body based on data from the lab, it's a super important tool, but it's not perfect. Figuring out how to connect those preclinical models with the crazy complexity of human biology, that's one of the biggest challenges we face.
It's like trying to predict the weather, but instead of clouds and stuff, you're dealing with, those cytochrome P450s and a ton of other biological factors.
Perfect analogy. And that's exactly why preclinical development is so important. It's all about reducing those unknowns as much as we can, gathering solid data, refining those models, and basically building a strong foundation for those clinical trials. It's where we put all those lessons we learned from those past failures into action.
Okay, so we got this foundation, right? Built on both the wins and the losses from season 2. So what's next? What kind of preclinical craziness is waiting for us in season 3?
Well, one really cool area is in vivo models. We've talked a lot about cells and molecules, but now it's time to see how these drug candidates do in a living, breathing system.
Yeah. Those lab mice and rats we always hear about. They're the real testers, huh? But why not just use humans right from the start?
I know, it sounds easier, but using animals first, it lets us check for safety and make sure the drug works in a controlled environment before we even think about giving it to people. Plus, we can study all sorts of things like drug interactions, dosing, and long-term effects, things that would be, ethically tricky and practically impossible with human volunteers.
That makes sense. But I bet picking the right animal model is super important. They're not exactly tiny humans, are they?
Exactly. Different species, they can metabolize drugs in totally different ways, and that can make a huge difference when we're trying to predict drug interactions. For example, let's say we're studying a new drug and we think it might mess with CYP3A, that enzyme that plays a big role in drug metabolism.
Okay, I'm with you. We want to see if our new drug messes with how CYP3A does its job. So we give it to some lab animals along with another drug that we know is metabolized by CYP3O.
Right. Exactly. Now, midazolam, that's a drug we often use in these studies. But in mice, midazolam isn't only metabolized by CYP3A. Another enzyme, CYPDC, gets in on the action too. And that can make it hard to figure out what's really going on and to accurately predict how our new drug might interact with CYP3A in humans.
So it's like trying to measure one ingredient in a cake, but the recipe has a secret ingredient that messes up your measurements. Super frustrating.
For sure. But the good news is we have other choices. In mice, if we use triazolam instead of midazolam, we might get a clearer picture because its metabolism depends more on CYP3A. Picking the right model and the right probe drug can make all the difference when we're trying to predict drug interactions in humans.
Wow, even picking the right animal model is complicated. But I guess that's what makes this preclinical phase so important. Got to get those details right before we even think about human trials.
Absolutely. And once we've got our models figured out, we need the right tools to analyze what's happening. That's where those fancy analytical techniques come into play.
Oh yeah, those tongue twisters like LC-MSMS and supercritical fluid chromatography, they always sound so high-tech.
They really are powerful tools. They let us see the tiny details of drug metabolism. LC-MSMS, for example, it's like a molecular detective. It helps us find and measure even the tiniest amounts of a drug and its metabolites in biological samples.
So it's not just about seeing if the drug's there, but also about figuring out what it's been changed into and where those metabolites ends up.
Exactly. And by measuring those specific metabolites, especially the ones we know can cause problems, we can really understand how a drug behaves in the body. Remember celecoxib. LC-MSMS would be perfect for tracking that reactive metabolite, helping us see how toxic it might be.
It's amazing how these tools let us track a drug's journey through the body, like following its footprints at a molecular level. But you mentioned another technique, supercritical fluid chromatography. What's so special about that one?
supercritical fluid chromatography that's a bit more specialized. It's really useful for analyzing compounds that don't like heat or don't behave well in the usual liquid chromatography methods. It's all about finding the right tool for the job, and sometimes we have to get a little creative.
Okay, so we've got our models, our high-tech tools. What else do we need to think about in this preclinical phase?
Well, remember, a drug's journey doesn't stop in the lab. We have to think about how we're going to make it, too. Scaling up from making tiny amounts in the lab to producing large batches of a consistent and stable drug product, that's a big deal.
Oh, right, going from a few milligrams in a flask to like kilograms in a factory. That's a big jump.
It is. And that's where polymorph screening comes in.
Polymorph screening, that's a new one. What is that?
So drug molecules, they can exist in different crystal forms. We call them polymorphs. It's like having the same building blocks but arranged in slightly different ways, creating structures that look and act differently.
So even though it's the same molecule, different polymorphs can act differently in the body.
Exactly. Some polymorphs might dissolve more easily, which affects how well the drug is absorbed, while others might be more stable during storage, so they last longer on the shelf. Polymorph screening helps us find the best form for manufacturing, making sure the drug works consistently and is high quality.
It's incredible how much detail goes into every single step. We have to consider the target, the molecule, its journey through the body, the tools we use to study it, and even how we make it on a large scale.
It really shows how complex drug discovery is and how important it is for scientists from different fields to work together.
And with all this complexity, we can't lose sight of the goal to improve people's health.
Yeah, it's mind-blowing when you think about all the work and expertise that goes into making a new drug. But then you think about how it could help people, relieve suffering, make lives better, and it makes it all seem worth it.
Definitely. And as we move on to season 3, I think it's important to keep in mind that everything we do, every decision we make, it's all about making a difference for patients in the end. Absolutely. But before we jump headfirst into preclinical development, let's take a minute to appreciate the successes from season 2. How do those wins, those big scientific breakthroughs, how do they help us moving forward?
Remember how much time we spent picking our initial targets? That careful work we did, evaluating things like biological significance, if it was even possible to drug the target, and whether there was a real need for a drug for that target that sets us up for success. Developing therapies that actually work and are safe. It's like choosing the right battlefield strategically so we're in a good position to win in the long run.
I like that analogy. And then there was hit identification and all that work we did to optimize the lead compounds. Remember those first hits? Those were like little sparks of hope. But they were just the beginning, right? It was through all that fine-tuning and tweaking that we turned those early compounds into real drug candidates.
It's medicinal chemistry at its best, understanding those subtle connections between a molecule structure and what it does, and then using that knowledge to design molecules that are not only potent, but also safe and effective in a real biological system.
And now we've got those optimized lead compounds and all this knowledge we've gained from both the good and the bad stuff that happened. We're ready for this next chapter? Season 3 is going to be a wild ride as we explore preclinical development.
It is, but even though we try to plan everything out and find that perfect formula for success, we have to remember that drug discovery is also about unexpected discoveries. Sometimes the most valuable lessons come when things don't go as planned, when we stumble upon something new or find a different way of doing things.
So even with all the planning and careful experiments, we should always be ready for those aha moments, those accidental discoveries that can really change the course of medical history.
Absolutely. It's that mix of solid science and being open to new ideas that often leads to those big breakthroughs. Who knows what amazing discoveries are waiting for us in season 3?
I can't wait to find out. And to everyone listening, thanks for joining us on this incredible journey through drug discovery. We're excited to have you with us as we dive into the exciting and challenging world of preclinical development in season 3.